And it is, this is dramatic, believe me. Because when you look at this, let's just walk through what this is. Now, I used to teach high school, so hopefully I can pare this down to everyone's level. So this is your neck.
Thanks.
Right? Right, Susan, you getting this? Even a gator can get this by the time. So can you hear me in the back? Am I using my big voice? Okay. So that's your jaw. This is your spine. Right? This is your carotid artery and jugular vein. Right? So this is sitting dead center. So to get into this, some surgeon is going to have to go and move every vital structure out of the way and hopefully get a big gaping hole, which doesn't happen. So this is a horrible mess for any surgeon, and dentist makes it look easy. And so that begins to bond that fellowship and that partnership. So then you go, the story that I really wanted to share with you is this. Now this sounds like a kind of a boring little topic. A sewing needle in your foot, right? Kind of boring. You think, oh, just go to Riverside, they'll take it out. Go to Mount Carmel or Berger, they'll take it out. Well, wrong answer. So we're speaking at Rotary in Circleville, and there is a microbiology professor from Ohio U in Athens who's at the Circleville Rotary. And he listens to this, and we talk about this. Now, this is a 25-year-old man, right? So this microbiology professor comes up afterwards and said, do you think you could possibly help me? And I'm thinking, okay, no big deal. He said, I'd had a sewing needle in my foot for 20 years. Now, he's a teacher, right? Pastor, imagine, taking care of Susan Robinald's wedding if you had a sewing needle in your foot and you couldn't really walk very well at St. Stephen's Church, right? St. Patrick's, wrong one. St. Stephen's. That's a good cap. There are a lot of St. Stephen's churches, that's right. That's good. All right, close. So he couldn't walk on a hardwood floor for 20 solid years, and the surgeons would not take it out. It was too deep. It would take too much incision. So it was not a reasonable therapy. So for 20 years, he was handicapped because of a silly sewing needle in his foot. So he came to Children's because there's no one else in the state or the next 5 states that are going to do this. So he gets on the table, and in about 10 minutes, it's out, and we completely changed his life. It may be a stupid little thing, but it's not stupid when it's your foot and you can't walk because you got a piece of metal in it. This morning,